This is the docuseries created by RCG Media and hosted by Perry Wash, the Phenom. And the Lost Art of Giving dives into the daily obstacles and challenges faced by our nonprofit and charitable organizations. Those out on the streets, grassroots, putting in work every day, the daily grind, but often lost when it comes to the art of giving regarding their fundraising. Many times, these owners and entrepreneurs who are impacting so many lives find themselves alone, having to come up with money out of their own pockets, sacrificing rent, mortgage, food, car note, whatever it takes to keep that nonprofit going. So this docuseries, we hope, will bring light and shine light on those who continue to give and to serve relentlessly and unconditionally. So this docuseries, we hope, will bring light. Please support these nonprofits as you see them now and forever. Let's all serve together and remember the lost art of giving.
Assalamu alaikum. Hello, everyone. Thank you all so much for joining me. Today is the first ever segment of The Art of Giving. Today, we're very honored to have Miss Paulette Smith with us. So, hello to you, and how are we doing?
I'm very good. Thank you so much, and thank you so much for having me here and having Faza on your show.
Of course, it's an honor, honestly. So, as soon as you're ready, we can jump straight into the questions.
Okay, then, let's go.
All right. So, my first question for you is many organizations focus on raising awareness, but how does FOSA ensure that awareness translates into real change for mothers and families alike?
Well, thank you for asking. And awareness is a trending, topic these days, and that's good because there's so many things people don't know about. We started out with no awareness of postpartum depression. I had never actually heard the term, and I'm a mother. I have children, but we have a daughter who's a medical practitioner, and she was the first one to tell us, to explain to us some of the information about postpartum depression. Unfortunately, it was too late for us to, help our Christina. If you read our story, then you know that Friends of St. Adams started because we lost our granddaughter to maternal suicide. And we were totally clueless about postpartum depression and some of the, other maternal mental illnesses that affect moms. Then they think they're alone. They don't think that anyone is experiencing that but them. They don't tell anyone because they find the stigma. They find they feel a little bit ashamed. And we found this out even with professional therapists. Sometimes they don't get the help they need, even though they are aware, because they feel like they can figure it out. They can kind of treat themselves. So at FASA, we just try to make sure, Friends of St. Adams, we try to make sure that we do everything we can. Like you, we have a podcast, and we try to do everything we can to bring awareness to birthing people and to the people who are caring for them and to the medical, world.
Okay, now that's beautiful. I honestly condemn you for taking something so burdening and making it into a beautiful nonprofit organization. So props to you for that. Another one we have here is, are we too late by focusing on the aftermath? So, as similarly as you said, FOSA supports families after a tragedy. But are we doing enough to prevent maternal suicides in the first place? Are we addressing the roots of the cause or just the consequence? What does FOSA do directly?
Well, what FASA does is through our podcast, through our website, through our, communicating with other organizations, we make sure that those organizations are preventative organizations. So anyone that goes onto our resource page will see the organizations that we work with, Postpartum Support International, which covers a broad spectrum, but then we also communicate with organizations that specialize in training, in awareness, to help families, help members understand what can be happening with a mother and how she might be feeling and how this might could lead from what has been typically known as baby blues. And I think the numbers are about 85% of pregnant moms are subject to get something called baby blues, which is something that lasts a week or two because the hormones in your body changing, and you have so much. You have a new human being that you just produced, and sometimes they suffer with baby blues. But we work with organizations that help moms through publications and through our podcast to see when that line moves, when that feeling changes from just a little I'm feeling down to to depression or to full-blown psychosis. And so we definitely work with organizations that specialize in that.
Okay, so what are exactly these organizations that you work with? Would like to
Well,
name drop?
we do work with Postpartum Support International, as I said. We also have an organization called One Common Bond, and most of these organizations started from a tragedy. Some of them started from a tragedy. One Common Bond, they actually, the owner actually was a Marine. She's a female. She was a Marine, military. She lost her brother, so it wasn't a maternal suicide, but she started One Common Bond so that the public could see some of the signs, some of the things they could do to help a family member who may be in a tedious situation or may be having suicidal thoughts or anything like that. And because she was in the military, she took it a little bit further. And now that program has become mandatory for Army recruits coming into the service. You never can tell what a person is going through. But what we say here at FASA is when a woman is, or when there's a birthing person, you can pretty much tell that she's pregnant. So you know that she might need a little bit of extra care, but you could be standing at the supermarket, you could be standing at a bus stop, and someone could be in trouble and you don't know it. But with the mother, it can be a little bit different. Also, the American Society for Prevention of Suicides, we work with them, and we keep in close contact with National Institutes of Health. CDC is where most of the figures are coming from, and so we make sure that we just have as large resources as we can. And as we're speaking now, whomever might be looking at this, people will contact us. We have the Birthing Collaborative. Marie Boone Clark, she actually contacted us. She went on the site, she contacted us, and she said, can I come on to the podcast and talk about some of the things we do in our organization? So we have, we work with Dr. Alan Lindman, who is really nationally known. He's brought 6,000 babies into the world with no mortalities. So we get positive people who know that it's unnecessary for mothers to be dying in the numbers that they are and not getting enough help. And especially in this country, because we're in the United States here, and we have a larger mortality rates than many countries that we would consider, well, they wouldn't be as well, but we do. And there's no reason for that.
Okay, so honestly, sorry, continue.
Good.
Okay, so I find it beautiful how you've kind of formed your own community of organizations I like, and how you kind of hold each other, hold their hand. So I appreciate all that you said, and I don't mean to undermine what you said by giving a very bland response. Another question I have here is, Does raising awareness truly change outcomes, or does it give people the illusion of progress? While systematic issues like healthcare access still remain untouched, such as in the US, healthcare might be a privilege to some.
Yeah, well, we do operate only in the US, but we look at what's going on around the world. And to answer your question, yes, awareness is very important, we believe, because it starts conversation, it starts discussion. And when people don't know something, they don't know. As Dr. Maya Angelou said, when you know better, you do better. And so we might not know exactly how many ears we're falling on. We could tell by our numbers of our podcast or whatever. We might not know if we saved a life. We have to try. We have to try, because what happened when Christina left us was we spent a couple of years saying, what if we had did this? What if we had did that? What if we had did the other? And we started FASA. We took that what if and turned it into, what if we made sure we learned more about this? What if we spoke to more people about it? What if we looked at what legislation is going through right now? We work closely with Moms Congress and looking at legislation that's coming out every year. Last year, 5 or 6 legislative pieces were put together. Things like making sure that moms are treated fairly at work, making sure that they're getting what they need to keep them mentally and physically healthy while they're working without making them feel less than, or making sure that whatever is in place. Many people have told us that they understood something was wrong with their loved one. They went to the doctor. They went to different places for help, and they were not taken seriously, or they didn't think their voices were being heard. So getting those stories out, that brings awareness. If something is happening in someone's home that's just like that, they can feel that, and they know then they can call our helplines. We have helpline numbers on our website, and they can call maybe one of the organizations that we have in place. We have a service called FASA Finder, and you can go onto our website, and I have a list of different things that we can help people find resources within 10 miles, and all they need to put in is their zip code. They don't need to give any personal or secret or sensitive information. So yes, I do believe that awareness is, you can never say enough about trying to save someone's life, or about just trying to let someone know if they're feeling down that they're not alone, and there are resources that they can go to and people they can speak with.
Okay, to be honest, I'm very impressed with your answers. So, on the topic of mothers and health, and without making them feel little, does should mothers be screened for parenting readiness? Like, would it be mandatory for mental health evaluations before childbirth? Should it be seen as preventive care, or would it be unfairly stigmatized, like stigmatizing women and invading their privacy in a sense?
Well, privacy
I
is
mean,
certainly an issue, especially here in the United States. And we don't want to infringe on anyone's privacy. But once again, once we know the resources are in place, and we know that women are liable to become mothers, this is something that's going to happen to a certain percentage of females. Also, postpartum depression, depression itself, and different kinds of mental illnesses and slowdowns don't just occur with the female. They don't just occur with the mother. They occur with the father. They occur with same, parents of the same sex. Really doesn't matter. If you're around little children, if you have the opportunity and the blessing of having a little one, then you also will face the same kinds of day-to-day lifestyle issues, and these items of feeling less than, feeling like you're overwhelmed, feeling like you're not getting enough sleep, not eating properly, feeling that you're not good enough, getting weary, things you never really thought about before in your life. You were feeling happy, excited, and you're given this story that this is the best time in your life. This is the best, most exciting time. Just get over it. And that kind of thing, many people can feel that, not just the birthing person. And yes, some information ahead of time. I would say encouragement rather than anything mandatory, because everyone is not going to get to raise children. Some people, that's a choice that people make. So having to be mandatory, I don't say that, but I say doing everything possible within the home, because there's also, when do you share this information with a young woman? At what age do you share this information that this might not be the happiest time of your life? Don't be afraid to speak up if you are a young mother or if you're pregnant, even if you're not in the best of circumstances, even if you don't think there's any help. Don't be afraid to speak up. When you're feeling down, speak up.
Okay, I see. And in cultures where women are celebrated as mothers first and individuals second, are we creating an environment where their personal struggles are ignored? What's
I
your
think this
thought on this?
Yeah, I think that is definitely a possible. One of the issues we find in speaking with our moms and trying to provide resources and information is it is typical, at least in our society, to put the baby first. The fact is that even though the baby is tiny and fragile, you don't want to drop the baby or anything like that. The baby's actually strong. The baby's at the part of life where everything in the universe is going to try to work. If that baby is healthy, everything in the universe is going to try to work to keep that baby alive and healthy. Unfortunately, that's not the same with the mom. And that's why we have to gather around her and make her universe, make her understand, yes, you can sit down. You don't have to feel guilty if you're not getting up every moment, whatever. We're going to take care of you, because a healthy, happy mommy makes the best healthy, happy babies. And so, yeah, if we are in a situation where we're putting the baby first, or putting what our thoughts about motherhood first, then we should look at some different cultures, because we're always saying it takes a village. I, I'm pretty sure that I'm Christina's grandmother. So Zane is my great grandson. So I've been around for a minute or two, and I've seen many, and I've traveled the world, and I've seen many different cultures. Plus, I've read and I know historically how mothers, the village, get together, take and support. But we've become a little isolated in our society, wherein she's out of the hospital in no time, and there's no manual, there's no booklet, there's no, if she has a mother, if she has a sister, if she has an aunt, that's wonderful. But if she doesn't, we don't always know what's going on. And we have become compartmentalized. So her medical doctor has his job to do, and the pediatrics doctor has a job to do. The gynecologist has their job to do, and no one actually all the time gets together and makes sure they're working as a team to make her feel whole.
I see. Okay, it really does take a village in this sense. And on the contrary, not really contrary, but have we romanticized motherhood to the point where women feel ashamed to admit they're struggling? As you mentioned, are societal expectations around the self-sacrificing mother contributing to maternal suicides?
Well, we don't have any figures on that, but we know when we are not overwhelmed and when we are not put in a situation where we're deprived of sleep and we're not eating well, when things go wrong, we know that makes us feel down. We know that makes us feel blue. What they call mom bashing, or just bullying the mom or expectations of the mom, especially from maybe family members, spouse, partner, whatever. Well, my mother did it. She raised 9 kids, and I never heard her complain. That kind of thing. No, that's not good. And so that's why we have conversations like the ones we're having right now, so that if someone's listening and they know someone who's pregnant, first of all, if they're pregnant, you're doing a great job. You're doing a great job. If you don't feel as if you're doing a great job, have a conversation with your medical care providers. Have a conversation with the resources that are out there. There are plenty of them. Glad to speak to you in a kind and gentle way. But if you still don't feel as if your voice is being heard, don't give up. Just know, yes, you just haven't spoken to the right person yet. But we say stop the shame, stop the stigma, stop the silence that causes the suicide. We want to get in front of all that so that no matter what's happening with her, she will not be ashamed or feel ashamed to speak up. And especially if she's not getting any better. Because if she's not getting any better, she's getting worse.
Beautifully said. Okay, so a change of topic on the challenges of fundraising. You mentioned how you have a hand, you and other communities are close. So, do you guys help each other? Do you get funded by other organizations? Or do you rely solely on the donations by the people?
Right. Well, we haven't been funded by any organizations monetarily at this time. We are self-funded, and we are funded with our donations. And we are young. We're a young organization, and we do realize that in the scheme of things, like everything else in life, in the scheme of things, you have to be around for a minute, unless you come in with your sponsors, your donors. You have to kind of prove yourself. What are you doing? How are you helping? Who are you helping? We're working on that part right now. But we do have sponsorship. We offer sponsorships on our website, and we have a Faza Bunny that we give actually free to any family that contacts us and tells us that they are grieving, especially for the children. We offer a scholarship for children who may have lost a mother that are now going on to higher education. As a matter of fact, we're in our scholarship season right now. So if there's anyone watching this podcast who has lost a mother and getting ready to go to college, especially a student of color, Latinx, Native American, all of the information is on the website about the scholarship. Just come in and apply. And we would love to provide that scholarship. But we're always looking for partners. FAZA, Friends of Zane Adams, was started just for the awareness and to help. But as we move on and we started our sponsorship program, our base is a marketing company. So I've owned a business since 1996. So for a way of helping people help us, small businesses, we offer marketing packages, and all of that, 100% of that goes towards funding FAZA.
Okay, so I understand that you started this beautiful organization because of your granddaughter, but over the years, has the intention diverted? Is it more now about the mothers in question, or is it always in your heart that I'm doing this to honor my granddaughter's name?
It's several fold. I'm always looking for ways to let anyone know who has a question where they can get an answer from to help them. So first comes awareness. That is first. Second, we're always going to memorialize Christina, but we just do that through our podcast. So we focus then on Zane because he is the one that is going to be, growing up, and we want him to know when he gets to be a certain age, He'll be 7 the 27th of this month. So we want him to know as he gets older how much she was loved, how much she was cared for, and how his mind will be formed towards moms. As he moves forward, hopefully he'll be a part of the organization. But awareness is our number one goal. And every time we get an opportunity to fall on the ears of a birthing person, a clinician, a therapist. One of the things we're always looking for ways that people can come into a young person's life who may have lost their mother, like a financial. Right now, we'd like to get a podcast going with a financial advisor who has direct knowledge. We know hundreds of financial advisors, but we would like to get a financial advisor, a speaker on our podcast who has some direct knowledge or has touched with a family who's lost a mother due to maternal suicide or struggling with maternal mental illness, and see how they put together a lifetime package for that child from the time Zane was 1 month old when Christina left us. So that's an entire lifetime to get him to college, and the children like him, the young people like him.
Okay, so a bit of like a follow-up question, really. But how do you define what is a maternal suicide and a suicide that just so happened to be 1 year into motherhood or before 1 year into motherhood? What's the difference, really?
You couldn't have asked a better question, because that's one of the legislative items that we're looking at now in Postpartum Support International and in other legislative organizations that work with maternal mental illness. We don't always know. Even Christina's death would not show up with that statistic because there isn't enough time and effort put into whatever goes on with the medical examiner's office, what goes on with the doctor, because we're just assuming that the mother did have a medical team, or if she was already in trouble. Now, if she was already in trouble and they were treating her, yes, that might show up as a maternal illness, suicide related to maternal illness. But if she was like Christina, who had no signs, and like story I just read a couple of days ago, a gentleman raising his son, mother was happy, elated all through her pregnancy, and a couple of weeks in, she started going down. And yes, they took her out and tried to get help for her, and everything did not work. But whether or not that was recorded properly, we don't know. So we are looking in every way we can when laws come up to see what we can do. That's a state by state issue. That would not be a federal issue. That's something that would have to do, I guess, maybe city by city, county by county, because each and every county here in the United States has its own way of recording deaths and what they put on a certificate, if that answers your question.
That does answer my question brilliantly. Okay, so another one here we have is FUSA helps those who comes forward. But what about the countless mothers too ashamed, isolated, as you mentioned, or under resourced to seek help? How do you reach the invisible? Or do you also aim to push them to come forward?
Well, what we want to do is encourage, like I said, and as we encourage them to get prenatal care, as we encourage them to get perinatal care, as we encourage them through the medical community. What happens is a mom will go in to see the doctor, I think it's like 6 weeks. So we want that to be, and also we have some programs here in the United States, especially if she has a doula, but we have some programs that are seeing her way sooner than 6 weeks. That's way too late for her if she's having trouble. If she's not having any trouble, okay. But if she's having trouble and not saying anything about it, if she had a doula or if she had a medical intervention, not medical, but a person with medical knowledge, a person like a doula, a midwife, they would see that. Next, the family members. So if she has a partner, bringing awareness to the partner so that people aren't overly concerned, but they are aware and concerned enough to reach out to the medical community if they think something is wrong. As far as pushing, we don't want to push because we don't know where we're pushing her to. All we can do is actively listen. We know this person. We knew them before they became a mother. So take everything she says seriously, especially
Oh,
if it's going on and not changing.
brilliant. Okay. When a mother suffers from postpartum depression, is the partner's role often overlooked? Should we start holding partners more accountable for providing emotional and practical support and to hold on a greater emphasis on shared responsibility?
Well, we definitely want to, again, encourage the partners to pay more attention. I think from what I have seen in the 3 or 4 years that FASA's been active is the I want to say nonchalance, but casual. You don't want her, you don't want to make her anxious. You don't want to make her wonder what's wrong with her. That's why active listening is so good. And we actually just did a couple of podcasts ago about active listening and what it means and how to actually do it. So I encourage people who are around birthing people, family members, partners, medical people. You have this, we have a system where you have time. You have a certain amount of time to be in that doctor's office. You are not sitting there for 2 hours, even if you want to talk for 2 hours. So we want the medical community, the mental health community, the doula community. We want everyone to think about active listening, meaning you're listening, not listening just to hear. You're letting the whole entire thought process come out. You're not blaming, you're not judging, you're not coming back with, no, it's not like that, because you don't know how it is for someone. So I would say, I don't know about holding partners accountable, but I would say definitely just making sure that there's more literature in the medical community, in the doctor's office, in the clinic, in wherever she's going, to give partners, family members, and everyone around her, give them that thought. Are we listening?
Okay.
There are
So,
tests. I'm sorry. And yes, there are tests. If she shows symptoms, if she's brave enough, or if she's aware enough to speak up about something that is bothering her, she might not be having suicidal ideations, but just something that's bothering her. If she is willing to speak up about that, there are doctors and nurses and in the medical and in therapy, in the therapy world, who can see that, spot that, and they have tests, if she's willing to take it, that could give them a better idea of where she is. But when she's not speaking up, or she's speaking her body language, or the difference in the way she was, she's not interested in that TV show anymore. She's not interested in, you might say, well, she's not interested in that food anymore because her appetite has changed or whatever. But watching and making sure it's not 2 or 3 things together. And also we found in our organization that it might not even be anything to do with the way she's acting. It could be that she's worn out from the other small children she has around her, or because she's worried about paying her rent, or she's worried about buying food. All of those things can contribute to depression.
I see. I 100% agree with what you said. I do believe there is a major difference with listening and hearing that many people might overlook. So, without generalizing, is there any exact symptoms we can look at, like look for in pregnant women without like generalizing it, or in a sense without it being, am I being clear here?
Yes, yes. Well, it is, it, we can't, I understand what you're saying, but we do have to generalize it because everyone is so unique. Everyone is so different. A sign that one person might show would not be, it would mean, it would just be something typical. And someone else might show the same sign, and it's a sign that, whoa, we need to talk. We need to sit down and just have some, let's see what's going on here. And like I said, we don't want to make things worse. I often wondered when I could see changes in Christina, but I'm a positive thinker. So I probably did say and would say, don't worry about it. Everything's going to be okay. Um, there's not, because I didn't see anything in the world that could be wrong that we couldn't fix. I didn't see anything. I had no idea she was suffering enough to take her own life. And I would have thought she would have told me everything. She was my granddaughter, but we raised her. Her mother was very generous with the time she allowed us to have with her. So she was like our baby. We took her to her first Disney World, her first bike, her first everything, her first Barbie house. So, of course, I felt like I could see everything that was going on with her. And yes, I saw, but I didn't want to push. And that's why we have made partnerships with organizations that are professional at helping partners, family members, medical community see what's going on. That's why we made partnerships with them, so that we, FASA, wouldn't be the one to try to figure it out. So we invite the audience, we invite anyone who has questions to visit us at the website. Just go in. Like I said, you don't need to put in any personal information, just your name, if you want to give your true name, and your email address and your zip code, and ask away. And we will do our best with FASA Finder to find resources within 10 miles of your zip code.
Okay, thank you so much, Paulette Smith. Sorry for mispronouncing your name, for doing this interview, and thank you for sharing everything that you just shared with me. I appreciate it, and I really appreciate you being on the show.
Well,
Thank you.
bless you, and I hope that it will be shared and will be helpful to someone. Take care.
You too. God bless you too, and good luck with your battle on the legislation.